Cari ni. Tak. Start. You introduce? Let's start. Madam, you show us. Start now. Madam, start.
Start.
Introduce. Open the slide. The name is good. You just open the slide and follow it. Acha kuch. Dr. Kaushik, you don't have here. Just take it easy. Bye-bye.
Okay, Assalamualaikum. Assalamualaikum and good morning, everyone.
Morning.
Okay, how are you?
Great.
How are you all?
How about you?
On.
Okay, how are you all? Are you good today? Okay, so now we come to the next day, the second day for our session. Okay, so for this session, we have our chairperson, which is the first one, Dr. Ratimala Ayakanu. Okay, so she is a lecturer from Faculty of Science under Biotechnology Department. Okay, she is a registered graduate technologist awarded by the Malaysian Board of Technologies. She is a highly analytical person and with extensive experience in biological research, documentation, and clinical laboratory environments. Okay, so about her PhD project, it is consists of clinical research. She has been doing clinical research also, and also with molecular research work, so doing genetic profiling and as well as tissue culture work. Okay, and then she is also familiar with compiling patient information data, collecting data from patient, and also implementing GCP, which is good clinical practice. And previously, she has graduated with master in biotechnology from University Malaya also. And then she has completed her degree in biohealth science from University of Malaya as well, right? And then also she has developed learning and teaching skills and have a strong knowledge in her subject, such as for her teaching subject such as molecular biology, genetics, and cell biology. Okay, and then she also has significant working experiences as before this industry. She is working as laboratory scientist at research lab, which is at International Medical University previously. And then about the publication, she has published few articles in international journals, and also for these past year experiences, and she has strengthened a combination of skills that give her a solid foundation upon which to make an immediate and meaningful contribution at education and research field. Okay, so this is about Dr. Ratimala Ayakanu. Okay. Okay, our second chairperson, this is Dr. Muhammad Gozuddin. Okay, he is not here. Okay, so I just introduced. He has about 10 years, more than 10 years.
Yeah,
Okay.
I will introduce myself. Assalamualaikum and good morning. Okay, I'm Associate Professor Dr. Muhammad Gozuddin, Faculty of Pharmacy in the Medical University College from last 10 years. Okay, okay, so welcome you all. Please. Okay, so the presentation guideline. I mean, you have open session 3B open paper session. Okay, so you have only 5 minutes, right?
Yeah,
5. 5 minutes.
5 to 6.
5 to 6 minutes, maximum 6 minutes you have to be conclude on that. Please emphasis on your research findings. Okay, so this is important, and we have question answer session after each presentation. Okay, so be relaxed. Okay, be relaxed. Okay, all the best.
And safety, sir.
I know, I know. Don't be panic. Okay, be relaxed. Okay, okay, okay. So. Start.
Okay, so
Okay, we're gonna start.
the session.
Okay, the first candidate will be Miss Jumilia. Her title is Psychological Impact of Earthquakes Among Children. Review. You welcome, Miss Jumilia. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Good morning. Good morning. Thank you for chairperson Dr. Ratri Malar and Dr. Muhammad. Before I present, I want introduce myself. My name is Jumilia. I'm from Indonesia, West Sumatra, Padang. I'm student Faculty of Nursing, Lincoln University. I want to present my research. The title is Psychological Impact of Earthquakes Among Children in Various Countries, a review. The picture is earthquake. Introduction. Earthquake is a phenomenon of shifting of the earth plates which result in sudden melt to strong shaking of the ground. Earthquake can last from a few seconds to several minutes and usually start with a rumbling noise. Earthquake occur suddenly and unpredictable. The statistic of earthquake present in Indonesia. This incident of earthquake in Aceh, Indonesia, 2004, which ranking 3 in the world. Studies reveal that traumatic experience faced by children is a risk factor for the development of post-traumatic symptoms in later life when individuals face the next traumatic stressor. How earthquake impact children? Children who experience earthquake are most vulnerable to trauma. They're easily exposed to health problems such as fever and sore throat. Often have nightmares, always feel sad, have difficulty to concentrate and to study, and difficult to get along with. And then children who experience trauma require special attention to heal themselves from trauma. Trauma in children can interfere with their development into adulthood. Aim of the study to study the psychological impact of earthquake among children in various countries. The method research type of study, a narrative review, composed of a recent collection of available research studies conducted on psychological impact faced by children from earthquake. The study sourced from 15 articles collected from literature search using PubMed, Google Scholar, and Scopus. database from 2017 to 2023. The literature search was carried by identify relevant article using keyword psychological impact earthquake among children. The study design, I have two criteria. One inclusive criteria is psychological impact earthquake on children. Only article English language. Psychological impact not limited for post-traumatic syndrome disease and earthquake apply to various countries. And then exclusive criteria is psychological impact earthquake on adult exclude and article not English exclude.
You have 2 minutes, huh?
The result this article the result is the article check over time in post-traumatic stress disorder among children, and the 80% of the children still had some post-traumatic syndrome disease 2 years. Discussion based of the result of a study or 15 article, it was found the earthquake can have an impact on children's psychology. This can be caused by the loss the children feel directly due to the earthquake, such as lost family, friend, ground, school, and so on. Conclusion, after conduction research on respondents, there are psychological disturbance in children who were victims of the earthquake in the form of suicidal tendencies, depression, anxiety, and post-traumatic stress. If this psychological impact is not immediately addressed, it can interfere with daily life and children development. It is hoped that the result of this study can become input of the authorities to pay attention to handling the psychological impact of disaster victims, especially and on vulnerable groups such as children. Acknowledgement is a nursing study Indonesia, Rosanda and team, Dr. Lina Tio, professor and co-professor, and Lincoln University. Thank you.
Okay, thank you, Julia, for your presentation. Any questions from the floor? Any questions?
Good morning, everybody. My name is Yesi Mavita. I'm from West Sumatra, Indonesia, country Indonesia. Of the 15 journal you found were incident psychological impact of earthquakes among children in various countries. Why the sample children, not adult? Thank you.
Okay, I want answer. The 15 journal, I bring the psychological impact of earthquake various countries in Japan, Indonesia, China, India, Italy, and Wenchun. This article. And then for the sample children, because the children have special needs and vulnerabilities when compared to adults, mainly due to dependence on other, developing physical and mental ability, and
lack of experience in solving various problems. And the trauma in children can interfere with their development into adulthood. Thank you.
Got your answer?
Yes.
Any other question? Yeah, only. Yeah.
Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'm Dia. I'm from Bandung, West Java. I introduce the earthquakes in Indonesia. Earthquakes occur in Indonesia and around the world. What's more, recently there have been earthquakes in all regions in Indonesia, such as Yogyakarta, Jogja, Garut. Yeah. Why is Indonesia prone to earthquakes? Thank you.
Thank you. The question. I answer. Yes, Indonesia is many incident earthquake, yeah, because Indonesia as a archipelagic country located at the confluence or four tectonic plates, namely the Asian continent plates, the Australian continent plates, Indian Ocean plates, and Pacific Ocean plates. Indonesia is one the countries with a high level of seismicity compared to other countries. Earthquake caused by the interaction of tectonic plates can cause tidal wave if they occur into ocean. Thank you.
I have one question. You are PhD in nursing, right?
Yes.
So it is related with nursing. I mean, how you correlate?
Yes.
What is the title for your PhD?
Yes, ma'am.
Same title? I mean,
Yes.
title.
The title thesis is Randai and Drawing for psychological trauma, Prof.
Psychological trauma.
Yes. Terus Sam the
Same.
thesis, Prof.
So, okay.
Yes.
Thank you.
And I'm background is mental health nursing, Prof.
Mental health nursing.
Yes.
Okay, thank you. Okay, all the best for your research.
Yes. Thank you, Prof.
Okay, thank you, Dumilia. Thank you for your presentation. Can we have our next candidate, Yesi Maifita?
Thank you, Prof.
The title Effectiveness of Giving Red Ginger Powder and Honey to Pregnant Women with Emesis Gravidarum in the first trimester at the Sungai Limau Community Health Center in 2023. Please welcome Yesi Maifita.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, ladies and gentlemen. Thank you for Chairperson Dr. Lati Malang Ayaput Kanu and Dr. Muhammad. I want to present my research. Before present, I want to introduce myself. My name is Yesi Maifita. I'm from Indonesia, West Sumatra. Okay, I want to present my research. The title, Effectiveness of Red Ginger Powder and Honey to Pregnant Women with Emesis Gravidarum in the first trimester at the Sungai Limau Community Health Center. Introduction, basically, ginger and honey plants, local products that are very easy to cultivate in Indonesia, especially in Pariaman, West Sumatra. It can be correlated with which we associate with a maternity, rise of pregnancy. Pregnancy is a matter that has quite an impact on every woman. A rise of pregnancy, which is a problem for women in dealing with it. For this reason, we deliberately carried on and of this reason to be able to help pregnant women with the risk of nausea and vomiting by giving this herbal drink which can help reduce it. The type of research, next slide. The type of research is quantitative. The research design is a quasi-experiment. One group pre-post-test design. Research please Sungai Limo Community Health Center. Research time on July 2023. The sample in this study was 38 pregnant women with fourth trimester. Sample, next slide. Sampling techniques is total sampling, data analysis, dependent test. Result. There was a decrease in the frequency of nausea and vomiting after being given treatment. Before being given treatment for severe MSS, 22 respondents, 13 respondents had moderate MSS, 3 respondents had mild MSS, and after being given treatment, 6 respondents had severe MSS, and active respondents had moderate MSS, and 14 respondents had mild MSS. Next slide. Basically, red ginger and honey plants, local products that are very easy to cultivate in Indonesia, especially in Pariaman, West Sumatra. It can be correlated with how we associate with maternity, rise of pregnancy. Red ginger is given on a day for 7 days. Red ginger powder is given in a dose of 1 gram, honey 25 grams, and mixed with 100 milliliter warm water. Next one. Thank you for attention.
Any questions? Okay, you can ask.
Okay. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Okay, Ms. Jizi, I want to present for you about this research. What are the benefits of the red ginger apart from treating MSS in a pregnant woman? Okay, thank you.
Yes, to treat arthritis and various muscular disease, reduce bad cholesterol and maintain heart health. Thank you.
Any other question?
Thank you. My name is Istiqomah from Jakarta. It's very nice presentation and very nice topic about the pregnant. I want to ask about what is the red ginger content so the can reduce the emesis in pregnant women. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Red ginger content is gingerol, sugar, and gingerol. Gingerol, yes, yes. Antioxidant, and anti-inflammation, and anti-cancer.
The cancer. Okay, any other question?
Only two questions. No, ma'am.
Yes, I have a question. Your sample size I saw is 38, right? Is that your preliminary study or that is your total sample for your whole study? Because I think the 38 sample size is very small to see the significance of the results. So I'm just asking whether you're going to collect more or that is only your sample
This
size.
is your first, preliminary data. Yeah, you need more. Only July 2023
Yes,
extract
July.
sample. Others, total sample. How much?
58.
38. Yeah,
Yes,
38
total
sample.
something.
Ah,
58.
so
58 of pregnant women. 3 women, 3 best, first 3 best.
I see. Okay. Saya suggest kat sini. I rasa harus tambah respondent.
Sample size.
Total number because the sample size sangat kecil. So sometimes kita tak boleh tengok the significance of the results bila kita study sample size dia sangat kecil. So saya suggest lah untuk tambah sample size.
so increase your sample size.
Okay, thank you. That's all from me.
Okay, thank you. Nice presentation. What is the conclusion for that? What is the conclusion? Last conclusion, conclusion.
Kesimpulan.
What is your conclusion on it? In 38 sample already you mentioned 18 seats and two is missing. 38 sample, right? You go for your result, right? So in this result, 22 plus 13 plus 3 is 38. After the treatment, 6 plus 18 plus 14, which is 36, and the 2 is missing. It's okay, no problem. But what is the conclusion for that? Based on this slide.
Yeah. The one and influence the ginger.
Ginger, warm water, and turmeric. Okay, yes.
Yes, increase frequency, nausea, and vomiting.
Okay, thank you.
Thank you.
Thank you.
Assalamualaikum warahmatullahi wabarakatuh.
Next, we would like to call Isti Choma. Am I pronounced correct? Choma. With the title Digital Education Improving Knowledge and Skill, a literature review.
Okay, thank you for the opportunity. Good morning, Dr. Ratinala Ayakadu. Good morning, Dr. Sri Muhammad. Okay, good morning, everybody. My name is Istiqomah. I'm from Jakarta, Indonesia. And I will present about my literature review, digital education, improving knowledge and skill of literature review.
The background. First is healthcare education is faced with many global challenges. Shortening of hospital stays, specialization of care, higher patient safety measure, and the shortage of clinical faculty are the reducing traditional opportunities to train health profession through direct patient contact. Outline at all 2020 as at all 2021. And the second one, profession education in the early stage is often dominated by theoretical presentation that lack connection to critical practice. Person at all 2022. The use of digital education research was found to complement learning in classroom research by allowing for more organized guidance. And it's recommended to improve interaction with stakeholders, namely nursing students, researchers or RN, mentors, and the educators. The objective is the paper aims to define digital education to improve the knowledge and skill of nursing students. The method. This article research was conducted using internet database, Google Scholar, PubMed, and Science Direct in September 2023. There is no limit on the publication date in each database. The research strategy used keyword in English education, digital education, improving knowledge, skill, and nursing students. This is to ensure that all articles obtained are relevant and appropriate, and then the full text is downloaded and saved. Inclusion and exclusion criteria. The first is original research, and then full text, and then research related to digital education, improve knowledge and skill in nursing students. And the journal runs from 2018 until 2023. And articles and journals are available in English. There are four processes for the literature review. The first is identification, screening, eligible, and including. And the final review, there are 14 articles that review. Methodology characteristic of the 14 articles review, 11 articles use randomized control trial, and 3 articles use design method, a pre-post test control group design. There are 4 articles use quasi-experiment research design. From 40 articles that have been reviewed, all articles use a questionnaire in your research evaluation. And from the 14 articles review, 6 articles show that the mobile application with additional nursing information can be efficiently use a wide range of nursing students to improve their knowledge of education and skill. The article suggests that blended learning provides pedagogical value when compared to online learning in terms of teaching undergraduate nurse clinical supervision skill. The research from Peters and Jorgensen found that results are still unknown to that what extent digital support is used in examination to implement competency orientation in vocational nursing education. Evidence suggests that the digital education or digital learning is at least as effective as conventional learning. Researchers present positive preliminary evidence to scale up target initiative to expand health education through digital tools while noting the diversity across studies. And this will help others to know the knowledge and skill gaps of health students around the world. In conclusion, we discovered that the terms of knowledge and skill, mixed digital education looks to be at least as effective as traditional learning. Further study is required to assess the impact of other digital learning modalities on attitude, satisfaction, and the patient-related outcome, as well as the negative consequence and cost effectiveness of digital learning.
These modalities include virtual reality, service gaming, mobile learning, digital escape room, and flipped classroom. The implication of for nursing education is a suggestion for nursing educator to innovate and learning by using digital learning to improve knowledge and skill. That's all. Thank you. Assalamualaikum.
Any question from the floor?
Any questions?
Okay, thank you so much for the time. According to your presentation, I have a question for you, because your presentation is really important for me. Because according to your research, so what is the kind of digital education that must come in the learning process in your study? Okay, thank you so much.
Okay, thank you. Most the kind of the digital education, the most used in this literature is application. Uh, but the application have a disadvantage. Uh, the, than the other apa, kind of digital education, such web-based design or the virtual reality or the escape learning or the flipped learning. So every kind of the digital education have disadvantage and advantage.
Okay. Thank you. I have one question to Ms. Istiqomah. From the article that review, which one the most effective, digital or conventional learning? Thank you.
Okay, thank you. From the literature review say that the combination from the digital education and the conventional education have to combine. So we can the high present in competition, especially for the knowledge and then the self education and satisfaction and then the skill. So we have combined digital learning and conventional. That's it.
You have 6 apps, mobile apps you're telling, right? Anyone two you can tell me which you have used in the 2 apps name for? Yeah.
Like the application for the apa itu namanya, skill lab, the example for the to measure the IMT index A1 when you match index like that, yes, and all the others application like how to injection or pemberian obat administration injection and administration medication administration.
So this is the people. I mean, they have been subscribed or what? How can we afford the app?
Or we have to download in the Play Store and then we can download the material from.
Here we have to pay.
Yes, we have to pay to download the.
Okay, thank you.
Thank you.
Okay, thank you. Next, we like to call Ms. Tahul Fatih.
Yes.
Okay. With the title Family Support to Improve Self-Care Adherence Among Tuberculosis Patient, a Systematic Literature Review.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning. Good morning, Professor. Thank you so much for the time. This is the honor for me to be here today to present my presentation about the family support to improve self-care adherence among TB patients. Literature review. Okay, here is my content. First, I would like to talk about the background, research methodology, research, and result discussion and conclusion. All right. As we know before, that TB disease is really high impact to our health. And then, according to the research study, TB is a chronic disease that impact the major cause of the heart problem, and then one of the biggest causes of death in the worldwide. And then about a quarter of the global population has been infected of TB disease, and the majority have died. And then, maybe I come from Indonesia. So Indonesia is the fourth rank in the country with the highest TB burden globally in the Southeast Asia region, and include the rate increased about 14% from 2020 to 2021. Okay, here's my purpose. My purpose is to determine the family support to improve self-care adherence among tuberculosis patients. Because that the self-care adherence is really important for the TB patient to complete their treatment. And then I know the health is not really uh, easy to get it, so that's why for the TB patient they have to more effort to get to be healthy. All right, this is my research method. First, my research method applied in the study was literature review, and then conduct for the four English databases such as PubMed, Global Google Scholar, Request, and Dimensions of Engine. And then the fourth study in my research is about the family support and self-care adherence from TB treatment. And then for the articles, I was collected for the published of the last 5 years, from the 2017 and 19 until 2023. All right, here is my result about the total 245 article, which is coming from the PubMed is 70, and Google Scholar is 114, and Procase is 39, and then for the dimension is there is a 22 article where it's screened in my research, and then I got five article where ultimate including in the review. So about the result. Uh, According to my literature review about the family support and the self-care, improving self-care adherence for the TB patient, so I found that the literature review provided overview about the family support was crucial for TB patient during treatment, because I know when family support, uh, some people actually they are some factor uh, influencing for the subject adherence for the TB patient, which is as the age, maybe education, and then so on. So in my research, I focus for the family support, because I think because according to my research, some of the study they found that family support is very crucial for the TB patient. Related for the increasing self-care adherence for the TB patient. And then I found also better family support for TB sufferer, the better level adherence. And then a family also play an important role in providing support during treatment for TB patient. I think we know that TB patient is the infection disease, so they cannot afford by themselves. They need a support from other people, such as maybe for the family and social support and others. So I think this is really important for us to focus for eliminate TB patient in the world. So, but I think Indonesia is still struggling for that. So I think we have to focus for that, and then yeah, we can in the future we can reduce our population of the TB disease in our country. So here's my conclusion. So my conclusion is for this review demonstrated that family support was important to improve self-care adherence of tuberculosis patient. Okay, thank you, Chairman. That was my presentation. Assalamualaikum warahmatullahi wabarakatuh.
Thank you. Any question from the floor?
Thank you. Thank you for the nice presentation, and I want to know about the what kind of the support family do you have in your research? And one question again, you talk about the self-care adherence of the TB patient. What is the factor influence to self-care adherence? Thank you.
Thank you so much for the nice question. Okay, right. Uh, yes, talking about the family support, what I think is maybe some of us we know this about family support, which is we have first is about the wait, okay. Oh yes, for the first I have in my research for this informational support, which is that if we have the TB patient in our family, so how to take the treatment or take the medication. Maybe this just for the information, because in our country they have to take by themselves to the family health care. So maybe they go to the public health and then they get the take medicine maybe for a weeks, and then weeks later they have to come back again. That the information I think is really important for them, and then also for the treatment others, and then for the second is about the appreciation support. But I think and the family support really important for us to appreciate what the TB patient did already. I think they already stress about the medication because they will talk long for the medication. Maybe I think we are the same treatment. Maybe for according to the WHO, we have to take maybe around 6 months for the treatment rights for the TB patient. So I think it's not easy for them. So they have to coverage their health by themselves, and then they have to struggle. So, but I think family support really important for them to take them. And then another one is about the instrumental support. Instrumental support is really important for them as well. According maybe they have facility, maybe because there is no money. I'm so sorry, just for information, Indonesia for the TB patient, not only for the medium to up for the the economy. Yeah, so they have to need pay for drug. I think yeah, the drug is the medication is free actually, but the transportation they have to take money for them as well. And also emotional support is really important as well. So emotional coming from the maybe family or maybe from other people such as friends and others. And also okay for the next question. Oh, the factor. Okay, factor. Okay. Okay, according to my literature review, actually, I found some of the factor that I just mentioned before. The factor can influence affection to self-care adherence, which is age. Yeah, age is affect to the self-care because if a TB patient is getting older, so but I think it's very different for the other people. So they will maybe some kind of they got the dementia. So dementia will maybe forget for the take the medication. So I think it's really important. And then for the occupation, so and then others knowledge, yeah, of course, yeah, education, knowledge, and then also family support, and then also economic status. I think this is the factor. I think a lot of factors there, but I found some of them from literature review is age, gender, education, occupation, yeah, self-care adherent, self-efficacy, sorry, family support, and economic status. That's all. Thank you so much.
We have another question, Tom?
Oh, okay, okay.
Okay, another question.
Okay, thank you so much.
First of all, thank you very much for your sharing.
Oh, yes, thank you, thank you.
Secondly, I think you can add your statistical method and statistical route to use the PPT to enrich your content of the PPT. That's a question. That's a suggestion.
Sorry, can you make it clear, please?
If maybe you can add your statistical method.
Okay, yes. I'm so sorry. Actually, I have it, but
because our presence is only 5 minutes, so I just
Oh,
make
yeah,
it.
yeah.
Thank
I
you so
think
much.
if you add your statistical method and statistical routes, your content of the PPT will be enriched. Thank you. Thank you.
Yeah, yes, thank you so much.
Okay, just is it information or is the question, maybe? Yes, really for right. Okay, thank you so much. Okay, thank you. Yeah, I will make it better for the future. Thank you so much.
I have one question.
Sure.
240 articles you have done, right? So they're talking about only tuberculosis or other disease. Why
Tuberculosis.
only
Oh,
tuberculosis?
no, tuberculosis.
Why tuberculosis? Why not other disease like cancer, like?
Because I want to focus for the family support for the tuberculosis.
So
That's
cancer
why.
patient also need to be focused on moral support, right?
Sure,
So
sure.
that's why. It's really limited if you want to go cancer or
Yes, actually, first I want to focus for that because my thesis about the TB disease and self-care. So that's why maybe after this I will compare for other disease for the discussion later. So, but I think for all of our research, according to the literature review, it's only talking about the family support in the TB disease.
Oh, sure. Thank you.
You're welcome.
Okay. So next presentation, Xiaoming. Okay, the title is Identification of Micromas as a Novel Potential Diagnostic Biomarker in Endometrial Cancer Meta-analysis.
Yeah. So, okay. Ini sama ke? Ini dah usah. Is it correct? Is this your slide? Yeah.
Hello everyone, my title is Indication of Early and Novel Potential Diagnostic Biomarkers in Endometrial Cancer Meta-analysis. My PPT includes 4 parts: introduction, methods, results, conclusion, keywords. Introduction is endometrial cancer is the most frequent gynecologic cancer in developed countries. Increasing evidence suggests that microRNAs may be potential biomarkers for the diagnosis and prognosis of endometrial cancer. In this study, we conducted a systematic review and meta-analysis to summarize the global research and to evaluate the overall diagnostic accuracy of microRNAs in detecting endometrial cancer. Methods is the relevant studies were identified in database bases which contains chloroquine library database. The quality of the studies included in this meta-analysis was assessed by using the quality assessment of diagnostic accuracy studies. Statistical analysis was conducted using data working the broad sensitivity and specificity. Summary reserve characteristic curves and area and curve were confirmed. The publication lines of included studies was assigned using the Biggs plot and centric plot. Result is according to the inclusion and exclusion criteria. 7 articles with 928 in the intro cancer patients and 751 controls were included in total. The point sensitivity was 0.84 and the specificity was 0.80. The positive likelihood ratio and negative likelihood ratio were 4.2 and 0.21, respectively, in our study. The diagnostic odds ratio was 40.98, 40.98, with an alpha under the drop curve of 0.89. Subgroup analysis suggests that weaker RNA-seq flat markers showed a better diagnostic accuracy. There was no significant complication bias. Conclusion is that meta-analysis suggests that weaker RNAs may be novel and non-invasive biomarkers for detecting individual cancer, particularly weaker RNAs which have potential diagnostic value as screening tools in medical practice. The keywords include weaker RNAs, diagnosis, endometrial cancer, meta-analysis. Thank you for listening to my presentation.
Thank you, Zaumini. Any questions?
Can you please tell me what is the p-value 7.5? So it is more than or less than 0.05. You go for your p-value. You go for slide. Yeah. That way, slide.
You go back.
Yeah. There is no significant publication whereby the p-value is 0.75, right? Yeah. Can you please tell me how you can get p-value 0.75? More than 0.05 or less than 0.05. Significance. How you can be doing significance of this?
P less.
0.75 is more than 0.05.
Right. So that's why just 0.75 is no significance for anything. So it's significance or no significance how?
Okay. Understand?
Okay, what is p-value? You tell me what is p-value.
Maybe you can explain what you mean by that.
The
whole sentence. There was no significant publication bias. P-value equals to 0.05. What do you want to try to say?
Sorry, my spoken English still needs improvement.
No problem. You can tell Mali also, she can understand. It's okay if you don't know. It's okay. 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 Thank you. Okay. Okay. So next presenter, Nirendana Risky. Okay. The title is Uncovering the Multi-Faceted Influences of Type 2 diabetes instituted in Public Health Center, Indonesia. Okay, so
keluar.
Okay, thank you. I will presentation.
Okay, thank you. Morning all, and Assalamualaikum warahmatullahi wabarakatuh. My name is Winadati Bagusantosa. I am from Indonesia. I will present it about my data uncovering the multifaceted influences on type 2 diabetes mellitus incident in public health center Indonesia. My supervisor, association, Prof. Dr. Nisa Nambiar and Dr. Adina Abdullah. Next. Okay. Abstract consists of number one background, number two research method, number three result, and number four conclusion. Background type 2 diabetes mellitus is an emergency disease that often occurs because of insulin resistance, which makes it harder for the body to regulate the blood sugar glucose level effectively. Like sugar intake, lack of physical activity, lack of knowledge, poor management of blood sugar control, and stress are different factors that promote the increase in blood sugar level. Objective to determine the contributing factor between self-care, knowledge, and stress related to the incidence of type 2 diabetes mellitus in the public health center in Indonesia. Research method consists of design, sample, time sampling, and research place. Design consists of this research use the correlational design with a cross-sectional approach during the period of July 31 to August 31, 2023. Sample. The sample for the correlation test with G power was selected from 92 respondents. Research place. Research place is Public Health Center, University, Indonesia. Technique sampling. The technique sampling in selecting the sample was purpose sampling based on inclusion criteria, namely type 2 diabetes mellitus, age 36 to 65 years, able to read and write, and willing to be the respondent in this study. Research method consists of questionnaire, content validity index, statistic test, and bivariate analysis. Questionnaire consisting of 10 self-care assessment questionnaire, 2000 and knowledge assessment questionnaire, and 21 stress management questionnaire. Content validity index of the research instrument was validated and assessment by 5 experts. Bivariate analysis. Bivariate analysis of the human statistic test. Statistic test to detect the relationship of dependent variable to the incidence of type 2 diabetes mellitus. Result. Result 1, self-management self-management p-value 0.000 less than 0.05. There is a significant correlation, and rho 0.631. Correlation positive, level strong. Result 2, knowledge p-value 0.012 less than 0.05. There is a significant correlation. And rho 0.305. Strength correlation positive, level weak. Result 3, stress factor p-value 0.023 less than 0.05. There is a significant correlation. And rho 0.0187 strong, positive, level very weak. Conclusion. The conclusion of study show that self-care management, knowledge, and stress have significantly affected the incidence of type 2 diabetes mellitus. What most influences type 2 diabetes mellitus? And thank you very much.
Any questions?
Assalamualaikum warahmatullahi wabarakatuh. Good morning. My name is Rusdi. I have a question for Hussein. What variable most related to type 2 diabetes incident in your research? Thank you, sir.
Okay, thank you, Mr. Rudy. My variable is the most correlated significant. This is self-care management because self-care management has p-value 0.000 less than 0.05 and have pro strength correlation positive and level strong. Thank you.
Self-care management. Thank you.
Okay, any other question?
Okay, thank you for the nice presentation. I have one question. According to your research, you say about the contact validity. So I want to know who are the people that to be contact validity index in your research. Thank you.
Thank you. Content validity index. I have 5 content validity index in my research. They are content validity index in my research. Number 1, doctor. Number 2, specialist. Number 3, psychology. Number 4, nutritionist. And number 5, psychology in my content validity index research. Thank you.
How many samples you collected for your study?
Sorry?
How many samples? Sample
Sample
size.
size.
Oh yes. Total my sample size is 92.
92.
Yes.
Okay. Do you have any controls?
No, this is primarily research. Yeah.
Okay. So this is not your final sample size.
Yeah. My total sample, my total population 262.
Okay, that is sufficient. I just want to ask what is sample size. So you're going to collect in only one center or?
One sector in
Only one center.
but in public health, in my public health City Indonesia, and in public health center in Kediri itu get 9 public center in Kediri.
Okay, it's a clinic, is it?
Yes.
Okay, that's all. I have one more question. Your age factor, we put 36 to 65, right? Is there any why you choose that age range? Why it's not until 72 or why you limit 36 to 65? Any reason why you choose that range? Age range?
Actually, total my population in my public health center 700 729, but I have rumus with G power and I get sample 262, and this is my data primarily.
Saya tanya pasal umur.
Oh, okay.
Choose 36 in the number you bukan 72
Yes.
Ada apa-apa reason tak?
Yes. I think uh, 36 to 65 because my research about smartphone application.
Okay.
Smartphone application, I think this age that get doing smartphone application, but more than
More than
65, not
Not able to use that.
yes, doing smartphone.
I have one question only. Just a suggestion. The p value you check, it is less than this for knowledge and stress factor. It is 0.012, it's more than 0.05. Just recheck it. This one also. Okay? Thank you. Thank you. Nice presentation.
Okay, next is Triamia is here. Triamia is here or not?
You're here.
So your PPT is already there? Got
Can you please use? No, you can search with PPT. PPT is not in the laptop.
The email I couldn't find.
Download ke email.
Emailnya IM sorry.
Okay, welcome. Triamia Ditani with the title The Effect of Lavender Aromatherapy on the Anxiety Levels of Pregnant Women in the Third Trimester in the Working Area of the Airport Health Center 2023.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It's an honor to be here with all of you. And I thank Lincoln University Malaysia to hold this amazing event for all of us. Honorable audience, without further ado, my name is Emiliana. I'm from Alifah Health Science College Padang, Indonesia. I will present my research entitled the effect of lavender aromatherapy on the anxiety level of pregnant women in third trimester in the working area of the Air Dingin Health Center 2023. Ladies and gentlemen, the anxiety rate among pregnant women in Indonesia reaches 28.7%, including anxiety regarding childbirth. If not treated, it can result in increased blood pressure, bleeding, and the risk of premature babies. Lavender aromatherapy contains linaloacetate, which is able to relax and relax the nervous system and tense muscles so that it can reduce anxiety in pregnant women. There is a purpose to determine the effect of lavender aromatherapy on the anxiety level of third trimester pregnant women in the Air Dingin Health Center working area 2023. Ladies and gentlemen, for the dependent variable, I use pregnant woman anxiety and the independent variable effect of lavender aromatherapy. For the population, I use 40 pregnant women in the third trimester in the Air Dingin Health Center working area 2023. For the decision methods,
The study is analytic descriptive study with a quasi-experimental design. And data collection was June until 29 June in the Air Dingin Health Center working area 2023. For data collection tools, the HARS questionnaire, and then Unified uses frequency distribution table, and Bifred uses the Wilcoxon rank statistical test. You may see the picture. Based on the table, the average rate of anxiety of pregnant women in the third trimester before giving lavender aromatherapy was mild anxiety in 7 respondents, moderate anxiety in 27 respondents, and self-anxiety in 6 respondents. And then based on the table 2, the average level of anxiety of pregnant women in the third trimester after receiving lavender aromatherapy was between 23 respondents and 17 respondents. Based on the table, it can seem that difference in anxiety before being given lavender aromatherapy 22.7 and after 13.2 giving lavender aromatherapy with a mean difference of 9.5 can be seen that there is a decrease in anxiety based on the Wilcoxon test obtained a p-value of 0.000. So it can be concluded that there is an effect of lavender aromatherapy on the anxiety of 3 trimester pregnant women in the working area of the Air Dingin Health Center 2023. Okay, according to the researcher assumption, anxiety experienced by 3rd trimester pregnant women can be overcome by giving lavender aromatherapy directly. The respondents agreed that using lavender aromatherapy for 15 minutes in the morning and 15 minutes before bed can be reduced anxiety. In addition to reducing fear and anxiety in my mind, pregnant women will feel calmness, comfort, and a sense of freshness and rest in the provision of lavender aromatherapy in the working area of the Air Dingin Health Center in 2023. By providing lavender aromatherapy, it is suggested that giving lavender aromatherapy can be alternative to reduce anxiety in 3 trimester pregnant women. It is hoped that pregnant women, especially pregnant women in the third trimester, can eliminate the anxiety experienced by pregnant women so that they can always feel calm and comfortable during pregnancy and prepare for childbirth later. Okay, this is for reference. Okay, that's all of my presentation. Thank you for your attention.
Thank you, Jaya. Any other questions?
Thank you. I want to ask a question. Why did you choose lavender aromatherapy to reduce anxiety in the third trimester of pregnant women? Thank you.
Thank you for the question. The answer is lavender is the most famous for aromatherapy that has sedative effect and hypnotic and then anti neurodepressive to human. And then lavender aromatherapy contains is linalool acetate. Linalool acetate it is known for potential of muscle relaxing and may relax help the thigh muscle. And then for the extra health safe, it's very useful to to normalize the state of emotion and unbalanced physical condition in human system. So it can apa namanya, relaxing for the pregnant woman emotion. This is the answer. Thank you.
Next question.
Thank you, Dokter. Assalamualaikum warahmatullahi wabarakatuh. I have a question for you. How many doses of lavender aromatherapy have been given to respondents? Thank you.
Okay, thank you for the question. For the doses, I will the answer is for 2 until 5 milli. You can use in this skin, and then massage for the body pregnant woman for 15 minutes. Yes.
So how you measure? So you measure the effectiveness by giving the massage therapy to the pregnant woman, is it? Massage therapy.
Yes, massage therapy.
So after the massage therapy, you asking questions?
Yes, I before I'm giving aromatherapy, the patient will be asked to compare a pre-test and post-test, and then with the hard question, I use what the difference
Before and after.
yes, after hard.
How do you record it? How do you record that? How do you record?
The answer of the patient.
For question hard.
When you ask the question, orally,
Face to face.
So you ask questions, then you record in the form.
Yes.
So how many milli did you mention this one?
2 until 5 milli.
Okay, this one you got it from previous literature review, or in what aspect you choose that 2 to 5 milli?
For I see
Literature.
research before.
Literature.
Yes.
Which software you are using for to calculate the statistical? Which software you are using?
Yes.
Which software? I mean statistical data, right? As standard deviation, mean, p-value. Which software you are using?
Software.
Software.
SPSS.
SPSS, SAS, not mentioned here.
SPSS, is it SPSS?
Okay, so next time, this is SE, capital S, capital E, standard error. Okay, just relation. And you have to put which software you are using. Okay, so the final presentation. It's Devi. The title is Effectiveness of Users Education Gains on Cognitive Development and Dynamic Network. Wow, nice title.
Okay, thank you, Doctor. Okay, Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I would like to say thank you for coming, for computer or chairperson and all participants in this room for coming to our presentation. Introduce myself. My name is Dewi Sri Natania, Doctor.
Oh, Devi.
My name is Dewi Sri Natania, and you can call me Dewi.
I'm from Bandung, West Java, Indonesia. On the occasion, I would like to present about my research on the title is the effectiveness of physics educational game on cognitive development in early childhood. Uh, okay. Okay, we start for my background in this research. Development disorders are often found in childhood. Not a few children experience development disorder, and one of them is impaired aspect of cognitive development. One of causes of the delay in cognitive development in children is caused by not optimal stimulation from his parent or helper. And so, physics education bill is one of the intervention that can be applied to improve cognitive development in early childhood. Okay, the objective of the research is knowing the effectiveness of physics educational game on early childhood cognitive development. And this is a theoretical framework for this research. Physics is a method for creating characteristic physics that are perfect for use in this study. I use this for implementation for my research. And this is a quiz for questionnaire to account this intervention. Okay, for research methodology, this research is a quiz experiment research with research design of two group pre-test and post-test with control group design. Sample selection in this study using proportion sampling technique. The sample is study was 38 respondents divided into two groups, namely 19 intervention group and 19 control group. And the instrument in this study is dimension change are short observation. This is a research procedure. Sequence 1 is pre-test, sequence 2 for intervention, and sequence 3 for post-test. For data analysis, I use univariate for frequency distribution, and for the bivariate, I use a data normality test. For I use the persistent sympathy test and independent sympathy test. Okay, this is a result this is for demographic data. For frequency distribution of child age is mostly 42% in 5 years old for child age, and child gender is mostly a woman, and the parent education is mostly senior high school. My mother work is mostly is a white horse and a parent rate of 34 years, and the student of children is normally. Okay, from the picture, the graph shows that is that in this study, the intervention group experienced a significant increase compared to control group. Yeah, this is normally test. Is data in intervention and control is normally. This is a result for prior sympathy test for a difference in level of cognitive development before and after the intervention in the intervention group and the control group. The result of the analysis using the prior test in the intervention group shows the value of the level of cognitive development with the p-value before and after the intervention of 0.000 is p-value under 0.5. in the control group. And the peak value before and after the intervention was 0.630, peak value more 0.05. This suggests difference between peakers and posters in the intervention group. Okay, in independent test, result from after the intervention post-test, pieces educational game on the level of cognitive development of children using the independent sympathy test, it was found that the effect of pieces educational game intervention was significant children cognitive development with a p-value of 0.000. Then, based on the comparison of the calculated t-value, saw that the amount 50536 more than t-table 2.028, and it can be concluded that it means the hypothesis O is rejected and hypothesis A is accepted. Okay, this is a fun question. This result from this result it can be concluded that hypothesis A is accepted and hypothesis O is rejected, which means that there is an effect of using quizzes in the educational game and cognitive development in early childhood. And suggestion, this question, the quizzes educational game method is one alternative application that can be used to stimulate children cognitive development in early childhood. Okay, this is my reference. Thank you for your attention.
Any questions from the floor? Expected, yeah, expected.
What do you expect?
Okay, I know for the study is so few sample and sample is too small for the study. I said to take a few for example for related to my thesis soon. The determinant of member of sample has been calculated using G-Power software version 3.1.8 and 0.7. I just use effect size 0.5 and power 0.80 alpha, so that the total sample size result were 34 with an attrition rate of 10% samples. Plus 4 sample, then the total number of sample need use 38 sample with 19 intervention and 19 control group.
Can you give? Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, and doctor. My name is Jumilia. I'm from West Sumatra. I any question for I'm interested your research about quiz educational games. This question is can be used for healthy children or sick children, and then what the implication of this research?
Okay, thank you. Thank you. This question, crisis intervention mobile application. This is for I think for solve the developmental of children is for healthy children, healthy children. And the research can be a reinforcement of other research on the use of mobile application in stimulating children development, both cognitive and after development. Researchers choose quizzes EduGame because it's an alternative media that can be used in learning to develop early cognitive childhood cognitive. That's it.
Okay, thank you.
Yeah. Okay.
Okay, just a suggestion for you. The graph, you have shown the graph, right? So there are mix of English and Malay. So try to put everything in English.
Okay.
Looking for more presentable. Okay, the control intervention. Few all the graph, I think, all got mixed up with English and Malay. So can you know what is the sample size?
Sample size is 38.
38. I just suggest you to add more.
Okay.
Yeah.
Thank you.
May I ask a question? So thank you very much for your presentation. So what do you think about this gaming everything to attract to the student, right?
Okay.
So go for conclusion, please. Okay. What is H naught and what is HA?
HO is uh, SO is effective this SA is SA is that so the pieces by application is can can be used for cognitive development.
Yeah, I understand, but what is the form of HA and H naught? I mean, what is HA?
I think you should put
HA
the whole
and
sentences.
sentences.
When you put HA and HO, you don't really
It is a null hypothesis with the alternative hypothesis, correct?
Yeah.
That's what I'm asking you.
Okay.
So it is more than and less than. So you get more than that. The result is conclude that HA is more accepted than H naught. So null hypothesis is rejected. That's why we have
That's how you have to explain.
Yeah, you have to explain like.
Oh, yeah.
HA, H naught means.
Okay, because the condition is.
Yeah.
Okay, thank you.
Okay, thank you very much. Okay, so thank you very much for presentation. Okay, so now we take a break. Okay, so the breakfast is on the way, I think. So please go in the lobby. Okay, thank you very much.
Jadi tinggal meneruskan dan beda pula. Satu beda apartemen. Iya beda kamar. Tapi bawa yang ini yang ini dia ada Diana Arianti. Arianti tadi je jangan oh itu PM sebenarnya ke video apa presenter lah yang ikut ada nama dia presenter dia lain kot yang Selepas epic mana tadi? Yang tadi apa tu dahulu?
These three presentations not there inside. 1, 2, 3 for your reference. I mean, that's a
Oh,
show.
okay. Tadi yang download yang mana ni? Yang baru download tu. Yang nama dia ni, application of society ni. Narisha.
Ni.
Ni
Dah rosak.
rosak. Oh ni rosak ni. Kita ini tak ada. Oh ni.
Bukan. Ini bukan.
Narisa atau Diana? Diana Arianti. Diana Arianti ada tak?
Yang depan ni
Macam Zujuan tu ada. Zujuan ni dia. Yang tu Nur Lusti. In Aini. Oh, in Aini. Oh, yang ni tak ada lah. Nur Lusti tak ada. In Aini. Okay, in Aini. Saya Huda.
Ni ada. Dah.
Huda ada.
Yang tak ada kan?
Sikit je. Yang ni lah tak tahu ada ke tak kan? Diana ni ke tak ada. Oh, tak ada. Tak ada juga. Diana ada.
Dia nak tak ada kan?
Itu je lah. Okay. Terima kasih.
Nanti dimasukkan ke YouTube nanti.
Ya, streaming.
Ke YouTube. Linknya nanti dikasih tahu.
Ada record kan?
Iya dong Kak.
Try Lincoln Mysticonis. Ya, Lincoln Mysticonis. Mysticonis.
Thank you. Cuma kita Allah tu beko lah tu makan tu zonta sampai lah pipis ya lah.
Ini kan ayah dulu. Nih. Kan barangnya Siko kan? Barangnya Siko letak kan?
Iya.
Udah. Terus dia. Hah? Kalau aku memang ada pikiran di situ.
Kuliahnya di sini Mak. Rawat ya. Saya semua ini kedua.
Berarti rata pertama ini tadi kemarin udah yang ini.
Coba ya Bu. Ya, coba lah. Nggak apa-apa kata itu tadi bawa ini. Atlasnya tuh kan cewek.
Oh, foto dulu aja Bu. Hah? Nana nih, Bu, nana bisa Bu. Bu, tolong foto bisa foto kan?
Kita gantian.
Cuman ganti ini ya Bu ya, kita ini aja. Kita presentasi. Nanti kan presentasi beneran.
Satu, dua.
Dari mana Bu?
Dari Padang, Padang. Ya.
Satu, dua, tiga. Nah,
Minta ampun harusnya. Ansiyetasnya kalau kampus minta ampun. Nafas.
Airport, oh.
Kalau mau orang ke ini
Buat ini.
kita soft.
ini ya, maksudnya jangan nampak.
Kayak
Apa?
kayak pas Bapaknya tadi.
Ini nggak apa-apa.
Ya, harus sama. My name is Fatia.
Satu, dua, tiga.
Sama. Tapi udah konsul.
Nanti kan tidak perlu lagi foto lagi.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I am Sita. I'm from Balikpapan student in One reason is
Bu, sekarang pulang aku video sampai on title aja.
tapi kalau ke situ ke situ.
Kesini lah, ngomong. Cuma sampai situ aku stop ya.
Ya.
Oke.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. I am Evina Felicita. I'm from Bengkulu City. I'm student in Lingkungan University of Science. Okay, I will present this my research on the title the relationship between the tegang dah.
Kok celana dek?
Nampak tegang nggak tadi Bu? Tegang ya Bu ya? Assalamualaikum warahmatullahi wabarakatuh. Relationship between knowledge and attitude towards ethical cancer represent preventive behavior regulation in the university. Next, introduction. Cervical cancer. Cervical cancer is a pathology and condition characterized by uncontrolled growth of cell. It's often molecules of the body.
Ini aku aja yang ini. How to keep educated why people have foreign ways to Southwest.
South
How to keep educated why people have foreign ways to dress South exhibition to prevent from litigation. Gimana sih caranya mengedukasinya?
belum sana ternyata belum faktornya nanti faktornya itu banyak jadi namanya transportnya ada transportnya dari sektor
Aku aja nanya. Aku aja. Aku aja tanya.
aku juga
Nanti tanya ini nanti.
iya aku tuh bingung di perusahaan itu aku pernah nanti mana coba
Nanya ini pertama aku sebenarnya alat ukurnya yang dipakai dalam penelitian ini. Oh, jadi metodenya. Alat ukurnya.
alat ukurnya
Sebenarnya apa sih jawab itu kan? Aku nanya alat ukur. Alat ukur.
instrumen
Ya.
instrumen is
Jadi, anak loh, itu rekomendasi this
Bukan beliau. Digoreng.
kelemahannya apa?
Kan ibu baru nonton resiko, kan? Terus kan ibu kan ini pakai model custom di reservasi ibu. Nah jadi ibu bilang penelitian saya masih mengukur misalnya hubungan antara faktor ini faktor ini. Tapi untuk rekomendasinya saya buat lagi telah lebih dalam apa judul ibu yang semua jawabannya ya itu kurangnya ya setelah hasil ini itu kelebihannya apa sih yang bisa didapat dari kalau kelebihannya dia belum kan cuma mengukur aja
tahu aja itu loh faktornya faktor pemanfaatan ya emang dia udah kasih pertanyaan
Iya. Yang nanya cuma supervisor aja udah.
dua sampai tiga
Ya pasti dua orang nanya.
bisa bisa saya nggak bisa
iya
Terus kayak gini, berdua bisa.
sama kali kami deh itu tidak ada jauh beda
Enak kan? Hah? Enak. Yang ini yang
Rekomendasi saya, ya, yang kedua saya bertanya, what are the follow-up recommendation of the result of this study for future researchers? Ya, langsung jawab itu my recommendation to future researchers to future researcher itu kan researcher researchers informasi mohon membuat perbedaan masuk itu harus
Iya, sama.
有没有中午？没带开口去，我得晚上再回去的。你有事吗？他不是吃那个啊？
Okay. Good morning, assalamu alaikum. Yes. Okay. So we'll continue for the morning session. Okay. So open paper session. Okay. So first speaker, Rabi Parimala Sari. Okay. The title is the influence of the first aid education on the level of knowledge in heart attack management. Okay, so you have only 5 minutes. You have to be complete your presentation. Please finish on time. Okay. You're the best. Okay, start.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is such an honor to be here with all of you, and I thank Lincoln University College, Malaysia, to hold this amazing event for all of us. Honorable audience, without future ado, I am Revi Permatasari from Alifah Health Science College, Padang. We will present my research entitled The Influence of First Aid Education on the Level of Knowledge in Heart Attack Management. Introduction. According to the sample registration system, heart disease is the second most prevalent cause of death worldwide after stroke. According to request data, heart and blood vessel disorder and becoming more commonplace every year. In Indonesia, at least 13 out of every 1,000 people, or around 2.784.064 people have heart disease. Heart disease can strike unexpectedly with symptoms felt everywhere. Therefore, before going to the hospital, people need to know if they are experiencing a heart attack and how to obtain care. Early assistance for a heart attack necessitates knowledge of effective early assistance for a heart attack as a dominant component. The will later be thought to be significant in influencing the person's behavior, in this case aiding the survivor. The purpose of this study is to ascertain how first aid training has affected the working environment and the Kuranji Community Health Center degree of expertise in treating heart attack. Method. The research used quasi-experiment method using the one group pretest post-test design approach. Location Kuranji Community Health Center,
The population in study were all heart patients with sample selection using accidental sampling of 175 people. Collection data use questionnaire. The data is this study were analyzed using statistics, namely the pirate test. Next. Result univariate. Before education, according to table, respondent average knowledge level is 10.46 with a standard deviation of 2.597. Before receiving first aid instruction, people had knowledge ranging from 4 to 60 on how to treat heart attacks. After the education, according to the aforementioned table, the respondent average level of knowledge following counseling was 14 active, with a standard deviation of 2.841. The degree of knowledge following instruction of first aid in the management of heart attack was the lowest 9 and the highest 19. Result before the often ranks increase in knowledge between before and after receiving first aid instruction in the management of heart attack is 3.73, as can be seen from the table above. The pirate sympathy test statistical, the finding reflect a p-value of 0.0, indicating that there is a relationship between the knowledge level prior to and following first aid training in the treatment of heart attack. Next. Discussion and conclusion. The findings of the study are also consistent with research by Ghani, which emphasizes that first aid knowledge is intended to equip a person with the skill necessary to act appropriately. According to the study's findings, there was a difference between participants prior and post first aid knowledge regarding the treatment of heart attack. The change in knowledge among respondents in the study was attributable to the community activeness characteristic that promotes in participating in education related to first aid in the treatment of heart attack. It can be concluded that there was an influence on the level of knowledge before and after first aid education in the management of heart attacks. Ladies and gentlemen, this is all my presentation. Thank you so much. Wabillahi taufiq walhidayah. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you. Any questions from the floor?
Okay, thank you for your presentation. My name is Meli. Thanks for the opportunity for me. I want to ask about your research. How is the process providing education in your research? Thank you.
Okay, thank you for your question, Ms. Welly. The process of providing education is carried out by first mentoring knowledge to respondent according to the inclusion criteria. The providing education to respondents 6 times with 2 weeks. The measuring the level of knowledge again after the intervention is given. Thank you.
Okay, thank you for your answer. Thank you, sir.
Any other questions?
No. Okay.
So what is the difference between univariate and bivariate? Why you want to do these two?
Perbedaan level knowledge before for after.
That's why you use univariate and bivariate. Yes, you go for certificate. You're using univariate here, right?
Yes.
Next slide.
behavior.
But I think why not use what the difference between these?
Because I'm mau melihat bagaimana pengetahuan seseorang terkait dengan pertolongan pertama sebelum dia tahu bagaimana tindakan pertolongan pertama itu, kemudian kita berikan edukasi, kemudian dia bisa tahu bahwa ini adalah tanda gejala dari serangan jantung, dia bisa melakukan tindakan secepatnya untuk pelayanan kesehatan di masyarakat.
So I have one question. How many sample size you have? I didn't see any sample size.
Sampelnya 175.
Okay, thank you.
Thank you.
Okay, the next, Berlian Kando, are you here? Berlian Kando, okay. Next presenter is Berlian Kando Sianipa with the title Associated Factors with Breast Self-Examination Behavior based on the RANAS model among women in Bengkulu City, Indonesia.
Oh, okay, yes, sorry.
Dia masuk screen sana dia kawal kat situ.
Good morning everyone.
Screen
My name is
screen.
Berlian. I'm from Indonesia. I want to present my research. The title is Associative Factor with Breast Self-Examination Behavior Research on the RANAS model among women in Bengkulu City, Indonesia. Breast cancer is one of the most prevalent cancer in women across the globe, ranking second among cancer of disease and fifth in terms of cancer mortality among women. Breast cancer is the most prevalent form of cancer in Indonesia and one of the many causes of cancer fatalities. According to data from Kelompok from the year 2020, breast cancer accounted for 16.6%. Monthly breast examination can detect breast cancer abnormality in a very straightforward manner by understanding the structure of the breast. It should be possible to detect pop-up alteration. Breast examination represents a screening modality that can be conducted at an early step. Breast examination refers to a diagnostic procedure in which a woman conducts a thorough examination for her or breast, employing visual observation and manual palpation to identify the presence of any abnormal cases of indication of breast cancer. Objective to determine the factor associated with breast examination behavior based on the RANAS method. This study has a cross-sectional design of 30 until 50 years old women comprises the study's population and stratified sampling was used to the select the sample. The result, distribution of respondent frequency based on risk factor. This variable has knowledge height 41.4%. Next. This distribution of respondent frequency based on norm factor, personal important, the height 46.1%. Next. This based on ability factor, confident in intonation, not confident 41.6%. This self-regulation factor, commitment, not important, 40.7%. The finding of the Kaiser statistical base indicate a significant association between health awareness and breast self-examination habit. A significant association was found between vulnerability and breast self-examination activity, as well between severity and self-examination behavior. Breast self-examination behavior is related to various aspects, including risk factors, attitude, norm, ability, and rest self-regulation. Conclusion: the Ranas model pertains to breast self-examination, hence necessitating the adoption of behavior modification in accordance with the Ranas model. Because breast self-examination is one of the most possible strategy in early detection of breast cancer if applied correctly. Okay, thank you.
Okay, thank you. Any questions from the floor?
Okay, thank you. Thank you for your time, and I'm Via from Bengkulu, Indonesia. Thank you, your presentation, Ms. Berlian. I have any question for you. Number one, what major instrument were used in your research? And number two, what are the follow-up recommendations of the result of the study for future research? Thank you.
Thank you for your ask. This my research. I was instrument using questionnaire and this questionnaire for myself, and I have done validity and validity test. The second question from the result of this study, I recommended to intervention behavior same through health counseling about breast cancer and breast self-examination with the Ranas model approach.
Okay, thank you for answer.
Any other questions?
Can you explain about Rana's model? What is Rana's model?
No, it's no need mic. She can tell from uniform.
Okay. Ranas model.
What is it?
The Ranas model, this is R risk factor, attitude, norm, ability, and self regulation.
Risk factor.
Risk factor.
Next.
The
Table before. This one. No?
Risk factor, variable, and have knowledge, and vulnerability and severity. The next, ability, attitude, and variable, belief about cost and benefit effort, and belief about cost and benefit this time. Then norm ability, the other disapproval and personal importance. The next ability factor is how to do knowledge and confident informant and confident in continuation. The last self-regulation factor, action control, remembering, and commitment. Thank you.
What is the age factor you choose for the respondents? Age.
Age factor. Age.
Selected few age, right? Yes, exactly. Fakta umur
umur 50 until 50.
30 until 50. Okay, apakah sebab anda choose 30 hingga 50?
Di Can I
Ya,
Yes,
kan boleh.
Ya. Untuk biasanya untuk melakukan sebenarnya melakukan usia dimulai dari usia 20 sampai 50. Tapi saya mengambil di usia 30 untuk di 30 juga sudah dianjurkan untuk melakukan berdasar examination for every month.
Correct, mammogram? Mammogram?
Mamografi.
Kerana ini breast self examination kan. So adakah ini berkaitan dengan apa yang kita buat normal medical text mammogram?
This hanya dilakukan di rumah untuk mengetahui apakah ada
Okay, I'd like to call next candidate Epina Felizita Bandu with the title The Relationship Between Knowledge and Attitude Towards Cervical Cancer Prevention Behavior Among Adolescents in Bengkulu City, Indonesia.
Dia nak habis mana? Betul ni. Dari sini.
No problem, you can. Language is only barrier.
I am Epina Felicita. I am from Bengkulu City. I am a student in University of Science. Okay, I want to present my research. On the title, the relationship between knowledge and attitudes towards cervical cancer prevention behavior is among adolescents in Bengkulu City, Indonesia. Next, introduction. Cervical cancer is a pathological condition characterized by uncontrolled growth of cells in certain regions of the body. Next, objective. The study is to investigate the correlation between knowledge and attitude and the adoption of cervical cancer preventive behavior among adolescents. Next, methods. The study employed is correlation design using a cross-sectional study. The study focus on a population consisting of input between the age of 50 and 17, specifically adolescent. The sample size for the study comprised 100 individuals. Next, conclusion. It is imperative to enhance the knowledge and attitudes of adolescents in order to influence their behavior towards preventive and cervical cancer. Thank you for attention. Sorry, doctor.
It's okay. Any questions?
Any questions?
Assalamualaikum warahmatullahi wabarakatuh. My name is Uli. Thank you for the opportunity. I have a question. According to your research, what is your research problems and what is your inclusion criteria? Thank you. Inclusion criteria.
Sorry, I asked, where are you?
Ya, boleh.
Tujuan dari penelitian riset saya ini adalah untuk mengetahui perilaku dan sikap terkait pencegahan cervical cancer terhadap anak remaja. Kriteria inklusinya itu anak remaja umur 15 sampai 17 tahun.
Okay, thank you.
Okay.
Any other questions on the floor?
Okay, thank you for the answer.
Thank you.
Now you have any question?
You choose the age 15, 16, 17. Kenapa ada apa sebab kenapa pilih umur 15, 16, 17?
Karena untuk di daerah kami khususnya di Bengkulu, anak 15 itu masih bisa untuk kita edukasi. Kalau sudah anak SMA, maksudnya anak kelas atas agak susah untuk kumpulkan.
Susah
ketemu.
That is the reason why you choose the age group.
Yes.
Okay. Any other questions?
Okay, thank you.
Okay,
Terima
thank you.
kasih.
Shall move on to the next presenter, Diana Arianti. Yes.
Dia lah tadi kan yang tak ada dia punya.
Diana Arianti is the director application positive affirmations to overcome all disease and diabetes medical solutions at Public Health Center, West Sumatra.
Yang tak buka. Ada yang lain? Boleh hantar semua tu.
Di dalam
Ada apa ni? Dalam pendek ke?
pendek.
Sakit ke? Aduh tak. Hazard. Bagi saya.
Kita nak semua dulu.
We'll go for next.
Okay, we go for next first. Okay. Zujuan.
Sujo. Okay. I'm for the next presentation. Later you can present. Okay.
Zujuan, the title analysis of hotspots related to post-traumatic stress disorders in high-risk pregnancy, site-space-based bibliometric analysis.
Good morning, ladies and gentlemen. My name is Julian. Today I'm going to introduce to you my restaurants.
Start, please.
Okay. I will share from the following 5%. First background. High-risk pregnancy refers to pregnancy with posture of social factors and certain complication of period, which may have the pregnant woman factors and require or lead to distortion. The incidence of post-traumatic stress disorder is estimated to be 3.1% to 15.7%. It may cause breastfeeding difficulties, impairment of the mother, infant relation, sexual behavior problems, and the impaired emotional development of the infant. There are many factors affecting PTSD. For example, adverse psychological aspects of pregnancy, complicated during pregnancy, traumatic birth experience, low-level psychological and grief for serious instrument givers. So, our objective, based on science-based research centers, how to spot and treat a post-PTSD in high-risk pregnant women at home and abroad based on visualized method. From 2009 to 2023, literature rate to PTSD of high-risk pregnant women was retrieved from China National Knowledge of Infrastructure and Weibo Size database. Such space of software was used to visually analyze two database. The result, keyword cost analysis. The modularity KOK reflects the structure of category of keywords model, and it is generally believed that if the value is greater than 1.3, the cost structure form is significant. SK measures the homogeneity of factors within the cluster, and it is generally believed that if the value is greater than 1.7, the homogeneity of cluster within the cluster is high. In English literature, the modulated cluster value Q is 1.5036, and S is 1.805, which indicates that the structure of this cluster is obvious, visible, and effective. In English literature, the total population in PTSD research are high-risk pregnant mother focusing on prevalence, influence factors, pregnancy, postnatal depression. This is Chinese literature. The Q is 15931, and the S is 1.8533, which indicates that the structure of costume is obvious, visible, and effective. This is Chinese literary highlight. Is postpartum depression, coping style, high-risk pregnancy, disease, and certain cerebral section family discourse. Keywords popping up. Keywords images reflects to keywords that appear very frequently in articles published within a short period of time. Key images can suddenly detect the frequency and increase of keyword experience, describe the relation between customer from a temporal perspective, and then combine with the keyword type, like graph, and jointly depict the time nodes of keyword experience and excitant effects reflecting the temporal. This is a Chinese literature keyword images, for example, postpartum depression, coping style, and the other
Science-based software can provide a new perspective of our registry to visualize the registry part product of PTSD. In this study, a systematic literature visualized and analyzing whose pattern PTSD in high risk was compared to provide clinician and registry with relevant reference on registry direction and cost prompts. Thank you.
Any question? Yeah.
Kita check lain tadi.
Hello, Julian. Hello, Julian. Your research title is very interesting. I have one question. Why did you choose this research? Thank you.
Thank you for your question. Postpartum PTSD is a depressing psychiatric condition that can affect the women following childbirth, particularly those who experience high risk. Postpartum PTSD was a serious impact not only the mother, the mental of the mother, but also the infant. There are few studies in Chinese, so I choose this.
Thank you.
Any other questions? I have one question. What do you mean by hotspots here? Analysis of hotspots. What do you mean by hotspots here?
Through science-based software, it can analyze the PTSD, focusing the author and some authors and some countries their research.
Okay. Any other questions?
What is the LLR analysis? Can you tell me briefly about LLR? Result.
Okay. Which one?
Which one?
Which one?
LLR login. What is the LLR? What is LLR?
The analysis solid science-based software.
Software.
What is the full form of that? LLR software. LLR full form is what? LLR.
It is the science-based.
This is the qualification for presenting the this. Presenting the alam tiba analisa
Okay. So okay. Yeah, I call that Dania.
Larisha.
Yeah, Larissa.
Application of positive effort to overcome the body image, diabetes, predisposition, and public health. That's one.
Untuk apa? Sertifikat Indonesia.
What is the name?
Kita mahasiswa kami, penelitian dosen dan mahasiswa, jadi mahasiswa yang maksudnya takutnya nanti dia yang di sertifikat gitu.
Ladies and gentlemen, my name is Marisa, major in nursing from Alifah Science College, Padang. In this good occasion, I have to present my research paper, collaborate with my lecture, titled Application of Positive Affirmation to Overcome Bad Image in Diabetes Mellitus Patient at Public Health Center, West Sumatra. Right before coming up into the substantial discussion, let me begin with some information about diabetes mellitus. Diabetes mellitus is a complex chronic disease that requires ongoing medical care with multifactorial risk reduction strategies of glycemic control. There have two main types of diabetes, type 1 and type 2. They are different conditions, but they are both serious. All types of diabetes have in common that because people have too much glucose in their blood, but we all need glucose in our body. The first one, patients who are injured and have diabetes will experience adverse physiological effect when permanent changes occur in their structure of the body. Body image disturbance is defined as a feeling of dissatisfaction with change in shape, structure, and function of their body. Why? Because it doesn't match with their desires. Positive affirmation should be used to overcome body image disturbances, because positive thinking is effective to reducing the level of dissatisfaction with negative body image. International Diabetes Federation (IDF) estimated the number of diabetes in Indonesia could reach 28.5 million in 2045. This number is 47 greater than the number of 19.47 million in 2021. Indonesia is one of the countries with highest numbers of cause diabetes and one from 39 countries monitored by IDF. The aim of this study to apply positive affirmation to overcome body image disturbance in diabetes mellitus patients at Public Health Center West Sumatra. The study used quantitative research with descriptive analysis with pre-experiment approach, conducted for 5 months, starting from March until August 2023. The study used compiled instrument by Brown in 1990 with the name multidimensional body self-relation questionnaire, whose population 3,070 patients with diabetes mellitus and 192 total sample size. Univariate analysis was carried out using frequency percentage distribution statistic for each variable, and the variate used t-dependent test with p-value 0.001 less than 0.05. Result, you may see the table. Based on table from 192 respondents, we found around 56.7% patients with diabetes mellitus have negative body image, and around 53.3% patients with positive body image. It means most of diabetes mellitus patients have a negative body image. We move to another table. We can see the average patient with body image before being given positive affirmation was 21.11, and after being given positive affirmation 30.2020. It means there is a relation between increasing difference after giving positive affirmation and body image disturbances. Discussion and conclusion. After the dependency test, there is a relation between increasing before and after giving positive affirmation and body image disturbance in diabetes mellitus patient at Public Health Center West Sumatra. Based on research, patients who just experienced the loss of one of the function of their body haven't fully accepted themselves, so they tend to feel isolated and consider themselves. Giving positive affirmation to diabetes mellitus patient is very important in order to improve the patient quality of life and raise enthusiasm. Self-acceptance, calm, and can gradually carry out activities to improve the patient body image. Thank you.
Any questions?
Thank you. My question is, why you interested in making this research? And then there's any obstacles during this research? Thank you.
Thank you for your question. Why did I choose this research? Because diabetes mellitus in Indonesia is one of the highest cases that causes diabetes. And in 2021, Indonesia is fifth ranked the highest diabetes in the world. In West Sumatra, especially Padang, is one of higher than the other city. Thank you.
Got your answer. Any questions from the floor?
You mentioned about the definition of positive affirmations, right? How you do the positive affirmations? Apakah macam mana you buat positive affirmations?
Can answer.
Yes, yes.
Once again,
Pemberian seperti afirmasi positif, seperti kata-kata penyemangat, seperti kata-kata positif, pemberian seperti kata-kata positif.
Oh, okay. Like motivational talk. Yes.
Yes.
Okay. Next, non lusty. Are you here? Non lusty putri.
Here.
Non lusty putri Setiawati. Ika Prastiwi pun tak ada. Ika Prastiwi mungkin ya. Okay, Lin Aini Isnawati. Okay, Lin Aina Isnawati will present title Self-Awareness, Self-Concept and Spiritual Intelligence, the mediating role of spiritual well-being.
Assalamualaikum warahmatullahi wabarakatuh. The mediating role of spiritual well-being. Spirituality in the life of individuals, especially students, and in influence on resilience in facing life problem, and as well as various aspects of mental health. Spirituality formation does not only include international relationship, but also an external relationship that is our people and greater power. God to achieve meaningful and purpose life. Spirituality is able to make a person's life gain a state of prosperity, awareness in it in implementing. Self self-awareness is important for the next personal and professional development, for developing effective nurse-patient relationship, and for enhancing nursing abilities. Spiritual can also cause positive self-concept when training student. Nursing student have a positive self-concept when making clinical decisions. Self-concept also influence spiritual well-being. Having spiritual well-being is necessary to provide appropriate spiritual care. Next. The purpose of this study, the research and to determine the mediating role of spiritual well-being in the relationship between self-awareness, self-concept, and
spiritual intelligence. Next. Method employ a correlation sectional design with a population sample 160 Indonesian students. Data recollection use scale, SIQ, self-organization, and self-concept instrument. Spiritual well-being scale and basic and analyze each person behavioral analysis and path analysis. Next. Demographic and variable characteristics statistics. Sex. Next. That is analyze. Calculation. Spiritual intelligence was directly affected by self-awareness, self-concept, and thus further improved by presence of spiritual well-being. The study suggests that maintenance of spiritual well-being is essential to exit in relationship. Next. The result of path analysis has that self-awareness and self-concept positive and significant influence on spiritual well-being and spiritual intelligence, and spiritual well-being partially mediate the influence of self-awareness and self-concept on spiritual intelligence. Therefore, it is a recommendation that Institute of Health Science Hapsawati of nursing student with profile.
Excuse me, sir, madam. Speak loudly. We cannot hear.
Okay. Yeah.
Loudly speak. Otherwise, everybody is going to sleep.
And spiritual integrated nursing learning to increase.
Loudly.
Suaranya lebih keras.
Yeah.
Yes. To increase self-awareness, self-concept, spiritual intelligence, and spiritual well-being. Thank you.
Any questions from the floor? 1, 2 questions. Any questions? No questions? What is the conclusion for your conclusion?
Kesimpulan.
Is there any recommendation?
Mengenai sertifikat can we discuss dulu. Kita kemarin itu mengirimkan di link itu kan ada presenter. Jadi memang nggak bisa kita sampaikan kita buat di situ.
This study was investigated the role of spiritual well-being in mediating the relationship between self-awareness. Hasil riset membuktikan bahwa kesejahteraan spiritual well-being memberikan kontribusi terhadap kecerdasan spiritual atau spiritual intelligence and self-awareness in nursing student in health science Hapsawati. So I'm recommendation to
Diploma,
bachelor. Yes.
LOI, ya LOI, surat ya betul. Dalam surat itu nama ini.
Diploma.
Nama dia langsung
Yeah.
saya.
Yeah, inclusion.
Okay, thank you for it.
Next candidate, Nurul Huda, with the title Determinants of Coping Among First-Liners Post-COVID-19 Pandemic.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for the great opportunity that I could disseminate my research result here. The title of my research is Determinants of Coping Among First-Line Nurse Post-COVID-19 Pandemic. I'm Nurul Huda. I am the lecturer from Universitas Riau Pekanbaru. This is our team. Salsabila is my student, and Melissa Kisai is our collaborative team from United States, and I'm the corresponding author. The background, as we know, that nurses are known to have one of the most stressful occupations in this world, particularly the ones who directly providing care to COVID-19 patients. And during this post-pandemic era, nurse psychological well-being are mainly concerned. We know that coping is the most influential factor that contributing to nurse psychological well-being. It's the second year of the research, and the first year's research, we found that almost 61% of our nurses in the first line was having a PTSD, post-traumatic syndrome disorder. That's why in the second we analytic how they cope after the post-pandemic. The fourth research is needed to explore the coping strategies and the determinant factor which establish their coping strategies during the post-pandemic era. Next. And the aim of this study, we try to investigate the coping strategies and determinant of coping used by first-line nurse post-COVID-19 pandemic. Methodology, we use a purposive sampling method for 45 first-line nurse in nurse area profiles. Based on the inclusion criteria, our inclusion criteria is the nurse who ever directly contact with the COVID pandemic patient in the emergency room or the isolated room for COVID. And data were collected using self-administered questionnaire by using DAS-21 for measuring mental health, BRIEFCOP for measuring coping style. We have OQOL, we just use the psychological dimension for the quality of life, and TSR for measuring post-traumatic syndrome disorder. We set the Mandal Bengkalis Riau. Why we choose this Mandal? Because at this time, for the east of Rio province, this hospital was referred hospital for the COVID-19 patient. A correlation analysis and linear regression using Ender method were performed. First, for the brief code, we have almost 28 items of the questionnaire, and we divide it into the problem focus copy and emotional focus copy. We construct the validity for the first questionnaire into Indonesian language first, and after the psychometric testing, we could divide it into problem focus and emotional focus. Problem focus comprised of 8 coping strategies such as acceptance, religion, training, humor, positive reframing, instrumental support, active coping, and emotional support. And for the emotional focus coping, we include 6 coping strategies such as self-distraction, venting, self-blame, behavioral disagreement, denial, and substance use. And we saw the most widely used coping among nurses are problem-focused coping. And we found that PVC were influenced by religions, post-traumatic syndrome disorder, psychological dimension with the adjusted R-square value around 35.6%, which means that this model influenced around 35.9%. And for the emotional focus, coping coping are interrelated with religions and psychological dimension, but not PTSD, with adjusted R-square value of 38%. So the conclusion of this research, both of PVC and EVC determined by religion and psychological dimension. This finding needs to be considered when planning intervention and implementing coping strategies among nurses who ever contact with the COVID-19 virus. Okay, research reports we got it from the Asian Development Bank through Underworld. This is our what number? Okay, thank you for your attention.
Thank you, Buddha. Any questions from the floor?
Karina asking question. You have a first and you ask two questions.
Assalamualaikum, Mr. Huda. Okay, regarding your sample, okay, as I can see before in your slide, you said there was 41 nurses, 45 nurses, right? Okay, so that is from one hospital.
One hospital.
So, may I know what is the total number of nurses in that hospital?
Actually, we have 100 nurse.
100 nurses.
100 nurse, and we have 100 nurse and 100 midwifery. In total,
nurses.
to 200.
More than.
However, for the inclusion criteria, we only collect the nurse, and whoever contact the COVID pandemic patient in the emergency room and in the isolated room only, because we focus on the first line nurse. But after the pandemic era, the nurse is distributed to another ward, like in ward of patient and other. However, they still have a PTSD.
So meaning like out of 100 nurses, all of them dealing with they was dealing with COVID-19 patients before. So but out of 100, only around 40% of them you have been evaluated for this post-traumatic syndrome, right?
Yes.
Okay, so do you think the samples is enough for your study?
Actually, if we want to have to see the impact, it's not too representative, because particularly for the project we have four hospitals around the Riau province, but in this presentation I just finished one hospital only, and the other has not finished yet. And because I use the linear regression, the sample I think that it's quite enough to do the linear regression, because the ratio is 1 to 10 for the variable. So I think that is quite enough. But if you want to see the huge impact, it could not be generalized, since this is only one referral hospital. So the limitation, the study, we could not be generalized in the other part of Indonesia, like in the west part of Indonesia or the middle part of Indonesia, because it's only one referral in one province. Actually, to represent this result, we are doing for hospitals.
Okay, thank you for the answer. Okay, and another one, in terms of the one of your factor is acceptance, right? Acceptance.
For the coping.
This one, for the coping strategies, right? So can you explain what about acceptance? What is the meaning of acceptance in terms of what?
Actually, it's based on the brief cop. You know the instrument of brief cop for coping?
I don't know.
Brief cop for coping, there is instrument for brief cop in coping who construct by cover, and I think that it's quite famous. And before the research, I did the psychometric to cultural translation first.
So meaning this acceptance in correlation with that.
So in the brief cop, there is 14 coping strategies. One of them is acceptance. Acceptance means that the person can accept the problem here, and they say that, okay, I deal with this situation.
Okay. Okay, thank you.
Yeah.
Okay, the next candidate, Helmani Suchi. Last candidate, Helmani Suchi. Okay, with the title, The Relationship Between Diet and the Prevalence of Hypertension in the Elderly at the Andalas Padang Health Center.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is an honor to be here with you all in your time College Croatia to hold the Asia Forum for us. Another audience, with other ado, I am Media Rest, I am Hamani Suci. The title,
Do you send the email?
Have you sent the slide?
Yes.
But it's not in the email.
Your email?
Hamani Suci?
Yes.
Your email?
Lydia.
Oh,
Mirna Lydia.
Lydia.
Lydia. Oh, Lydia.
Okay. Tak ada.
No, you didn't attach this slide.
Ada ni. Ada dalam.
Okay.
Ichas at Lincoln.
Ini tak boleh cas.
Boleh?
Dia nak hantar ke Ichas ni itu.
Awak ada masukkan dalam tu, masuk dalam taging. Boleh masuk situ. Tadi.
Sudah. Okey, beda. Perbedaan.
Tak.
Tiga lagi.
Sorry. Ichas.
Tinggal ke sini. Ya, dalam lagi.
Tak bisa?
Ini dia tak masuk lah tadi.
Lambat. Baru masuk.
Lambat itulah.
Sudah ada masuk.
Okey, sikit lagi. Kurang lagi. Ya.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is an honor to be here with all for you. and thank Lincoln University College Malaysia to hold the amazing event for all of us. Honorable audience, without further ado, I'm Lydia Restipa from Alifa Health Center College Padang. Will present my research until the incident of hypertension in the elderly at Andalas Padang Health Center. Next. Hypertension is one of the non-communicable diseases that often fall in the community and has become a global problem because progression continue and insert for year to year. The number of cases of hypertension in Indonesia based on stats data. Any problems in hypertension in Indonesia 21.4% with estimate income and hypertension case Indonesia. Next. The prevalence of hypertension is 69.5. The most incident for hypertension. The method design method personal study variable feeding pattern independent and incident or hypertension is variable dependent. Population 110 early and sample for 30 elderly. Okay, result. Incidence of hypertension based on the table to 30 respondent more the help on the result were often namely 17 respondent expanded grade 1 hypertension. Feeding pattern based on the table for 30 respondent more the help on the result will then namely 10 respondent with risky death pattern. Next, the incidence of grade 1 hypertension was grade in people with insubordinating pattern, 2-3 people with problematic pattern. The result statistical test actually the chi-square. They saw a p-value 0.013. Discussion, check in PPL and lifestyle with hormone-integrative disorder by hypertension are to blame for the rise in high blood pressure. A how lifestyle is practiced that involves not having any physical or mental health issue. Maintenance in diet to keep the incidence of hypertension in hypertensive patient under control in one strategy to maintain health lifestyle. Degenerative disorder like hypertension are often common in those with poor eating habit. The majority of people to the like to earn healthy foods and food will growing. Conclusion is study conclude then is a relationship between diet and incidence of hypertension in elderly at health center Padang. Center Andalas Padang. Thank you.
Any questions from the floor? Yeah.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for the opportunity again for me. I have one question for you. What are the benefits to your research? Thank you.
To the question, increase the knowledge of elderly people to be able to control their blood pressure and control of diet elderly to help.
Okay, thank you for your answer.
Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Thank you for the opportunity. What some criteria in research
Okay, thank you. In the question, I get the sample with criteria inclusive, only age 60 until 75 year old.
Any other questions? On the floor?
Tiga orang tadi.
Thank you. Yes. We have another presenter. Oh, wait. Okay. Let.
Di mana tiga IT ya, IT di sana.
IT juga kurang.
Kalau hari biasa tu dekat mana? Mas campus.
Ada beberapa belakang session.
Kalau dekat kan dekat stesen apa staff ada apa?
Custom maintenance dengan IT. Pun kan?
Baik teknik.
Oh ni ke? Oh boleh. Masih kat kan? Belakang diri saya kalau nak pindah projector. Dia lama. Dia kena bagi balik.
Banyak tu.
Ada 8.
So macam memang ada je lah. Okay juga.
Kadang-kadang kalau Rabu pagi-pagi mau ramai orang. Sampai habis.
Kita pun tak tahu pula. Itu pernah benda dekat foundation je. Kat bawah
Orang tu belakang reception. Belakang tu kan ada bilik kaca. Belakang bilik kaca. Ada pun saya tapal projector.
Memang ni lah. Ada kena
Saya ada seorang dalam dia tu saya dengan seorang ni. Seorang lagi tu maintenance. Boleh wakil Syafiq. Tolong selalu bilik kalau ada salah bawa tahu. Dan saya
pergi je lah ikut lah. Rushdi.
R-U? Yes. Rusdi. This one, no? This one?
Yes.
Loud ya.
Buka kita buka.
Okay, our next candidate is Rusdi. He will present
development to improve patient safety culture among nurses in hospitals?
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good day for everyone. The honorable auditor and presenter. I'm Rusdi. I'm supervisor from Farida and Sasana. My title empowerment to improve the patient safety among nursing in hospital. Patient safety is an important concern from healthcare and worldwide. Patient safety is very important to element to improving the quality that issue in healthcare service. As like a health worker in the hospital, nurses directly play a very important role in patient and nurses playing integral roles detection and prevent to effective problem. Next. Patient safety, its definition is prevent to error in effect occur on patient safety related to health service. Patient safety has a lot to do with prevent to health worker and error so that possible the harm to patient can be prevented. Is a problem medication error cause of injury and of double harm in healthcare system. From international medication medication error are estimated to cause major loss $42 billion per year. Nursing playing the major role to improve the quality and safety of service through empowering, managing, and reporting every incident and having impact to patient. Hospital can we make effort to improve, proving nurse to be able to up the skill through training, increase the knowledge and skill. In Samarinda, we having accreditation, but lack of the patient safety report is issue who show is for moment nursing improvement to quality of care or is from actually condition, making enable to become the learning process for continuing improvement. Patient safety is very complex and worldwide health problem is important part of quality of care. Standard in Indonesia determined to should be finding related to patient safety or zero case. But condition report on patient safety is indicator Indonesia data is Kalimantan is 5.5%. As Samarinda is issue patient safety is very important, but impact for the study concern for nursing process the not necessary for confirm the patient safety in Indonesia and the hospital regulation. The purpose is to access the effect the empowerment on patient safety in among nursing in hospital. Next. This is my method, a cross-sectional study, descriptive analytic, sitting time hospital in Samarinda in Indonesia. My sample 199 respond, technique sampling, professional writing sampling, inclusion criteria carrying and current department 1 years, exclude action. Questionnaire, I'm using informant questionnaire and hospital survey on patient safety in culture. Next. This is my process research. The first pre-interactions, orientation, next and to give questionnaire, termination. Next second, collect data and third, and to analysis using structure equal modulating same. Yes. This is a result from characteristic of participant. Majority female subject, rata average female. My sample 113, 95%, and total career and dominant in 1 until 5 years. 70%.6. Next. From this is a distribution for indicator from variable environment and patient safety. High average in opportunity indicator of activity is mean 15.8 15, and in patient safety high average to teamwork within unit is point 16.370. Next. Next, I am author VIV. This is using to next for validity and reliability. This case menunjukkan poin overloading more 0.7 standard quality and reliability. Next. As a point overloading alpha combats, this pointing outer score alpha combats ini 0.973. It is more 0.7 for alpha combats. Variable environment and patient safety.
Only pointer.
For all indicator point level score height more 0.7 alpha combats for all indicator environment and patient safety. Next. This is score coefficient R square score 0.45.8. This is score to can be interpreted the variable as contract of patient safety can be explained by variability on environment factor 45-80%, and the remaining 54.20% explained by other variable outside and the study. Next, I am using Smart Pair S. Smart Pair S from this PET coefficient p-value 0.00. Is this more say 0.005? Okay. This is model PET coefficient correlation to affect empowerment to improve the patient safety score. Next. Factor can increase the environment level include education, clinical skills, knowledge, and confidence. However, some factor and disease level environment in workplace, such as for leadership management, lack of education or opportunity for staff development themselves, lack of support, and the lack of the respect. The dimension building patient safety improve many person in hospital, including management, both lower, middle, and upper level management, nurses who implement the patient safety culture in the service to patient. First, there will be support from management board, some of advice and infrastructure related to be related information related objective action by the hospital or improvement patient safety. Yes.
You got 1 minute.
Yes. Conclusion, environment for significant effect of patient safety culture in hospital. Environment has significant effect of the patient safety in the hospital. This positive and significant coefficient value indicate that the better the quality of environment. This will be have implication for higher patient safety culture in hospital. I think enough.
Okay, any questions from the floor? Okay.
I have one question to Mr. Rusdi. What indicator are most related to patient safety culture?
Thank you for question. The high indicator from patient safety in indicator cooperation in unit is the point 1.843.
One more. Okay, I have a question. Okay. Ma'am, you can go for the introduction. Only suggestion.
Yes.
Everyone, I want to be highlight here. How is design? What is this one? Anybody know?
Citation.
Citation. From morning we are hearing nobody put the citation on introduction. Actually, citation is very important to everybody. To put the citation on your introduction, background of the field. Only his put that one. Okay, so just a suggestion. Okay, one thing. And second, when you telling something so 0.73 no 0.13 something after points you have to be tell individual 0.134 73 is totally wrong. And your data is 180, correct? And you go for the data. Yeah. Here 130 plus 90. Only 6 mean not understand. Why only 6 mean?
It is not balanced.
Yeah, it's not balanced. How you can
It is supposed to be balanced, like 50,
60. This 6 means it's totally, you know.
Can consider lah, like 90%, more than 90%
Yeah.
from female.
Like this. Okay, just it's a suggestion. Okay, other than that, it is a PhD nursing.
Yes.
Okay, thank you. Next.
Dah buka aja.
Oh, dah buka.
Okay.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, Thank you, Mr. and thank you for all people. I will presentation my article, my article, the title, the relationship between suffering from hypertension and level of knowledge, attitude, and stroke prevention behavior and hypertension sufferer. Hypertension is a condition where a person blood pressure increase above normal, which can result in increased morbidity and mortality. The prevalence of hypertension based on 20 and 18 Ministry of Health data in Indonesia reached 31 and 31.7% in population aged 18 years and over. About 60% of hypertension sufferers end up having a stroke, and this disease affects almost 15% of the world adult population. The impact of hypertension is not treated; it can increase the risk of stroke. Research the real purpose, analyzing the relationship between the duration of suffering from hypertension and the level of knowledge, attitude, and stroke prevention behavior in hypertensive patient. Special purposes, analyzing the relationship between the duration of suffering from hypertension and the level of knowledge of stroke prevention in hypertension patient. Two, analyzing the relationship between the duration of suffering from hypertension and stroke prevention attitude in hypertension patient. And three, analyzing the relationship between the duration of suffering from hypertension and stroke prevention behavior in hypertensive patient. Research method, research design using descriptive research with a cross-sectional approach. Population and sample. Population, all 180 people with hypertension sample, 124 people from hypertension sufferer. Sampling technique. The sampling technique used is purposive sampling. Place and time of research. Place in Mendin Village District, Kebenarum, when 17 until 21 June 20 and 23. Data analysis. The data analysis used was univariate and bivariate with present chi-square. Research instrument using a list of question in the form of questionnaire in the questionnaire. The next one. Research result and discussion. The gender of most respondent was female, 17 and 3.4%. Based on the duration suffering, upper 5 years as many as 50 and 3.2%. Age characteristic, the majority are in the 16-year age range. From the level education of respondent, most had SMA or SMK education, high quality, high SMA, senior high school. The majority of respondents had good knowledge, 60 and 67%. The patient attitude was in the good category, 15 and 8%. The behavior of sufferer in good category was 60 and 2%. There was a relationship between the duration of suffering from hypertension and the level of knowledge of stroke prevention. The longer the exposure, the more knowledge about hypertension will increase. There was a relationship between the duration of suffering from hypertension and stroke prevention attitude with a person. There was a relationship between a duration of suffering from hypertension and stroke prevention behavior in hypertensive sufferer. The longer conclusion. There was a relationship between the duration of suffering from hypertension and the level of knowledge of stroke prevention. There was a relationship between the duration of suffering from hypertension and stroke prevention attitude with a person Chi-square. There was a relationship between the duration of suffering from hypertension and stroke prevention behavior in hypertensive sufferer. I think enough. Thank you.
Any question from the floor?
Thank you for the time. Mr. Denny, I want to ask, if we see your result, you get attitude and knowledge and the behavior, the level is good. Yeah. So what recommendation that you give for public health center that you have did your research of that? Thank you.
Thank you. The decision was taken public health, or we call Puskesmas, Center of Public Health. Public Health Center. I'm sorry. So one of program from Public Health Center is posyandu lansia. We call it posyandu lansia. So I am took on research the posyandu lansia. So we find almost of respondent sering, mohon pakai bahasa, sehingga ketika bertemu secara luas bersama-sama teman-teman yang menderita hipertensi, ya, the same hypertension, so dia akan memiliki motivasi yang tinggi, kemudian akan sama-sama melakukan pencegahan. Dengan bersama-sama, dia akan memulai semakin lama semakin intens, atau semakin lama dia akan semakin intensif dengan sesama penderita. Dan di program posyandu tersebut adalah untuk pencegahan. Salah satunya adalah pencegahan di hipertensi. Sehingga rata-rata kebanyakan untuk pasien hipertensi, pencegahan hipertensi menjadi lebih tinggi. That's my answer.
and number three, you mentioned the only word different is attitudes and behavior. So for me, attitude and behavior is the same. Same. So how you differentiate? Sama ke lain?
Mestinya ini
Attitude
adalah
tu apa?
behavior.
Behavior dengan attitude sama aja kalau bagi saya.
Behavior sama attitude berbeda.
Berbeza.
Yeah.
Okay, boleh explain apa perbezaan? Bagaimana you measure attitude and behavior? Apa perbezaannya?
Untuk attitude, dia adalah sebuah sikap sebelum melakukan tindakan, before action. And behavior is hasil dari sebuah tindakan atau result of action. So behavior is kebiasaan.
Practice lah, meaning practice.
Practice.
Yes. Practice and attitude, sikap.
So macam mana you analyze yang itu questionnaire?
Yes.
Any other questions?
Simple.
Sample size dia berapa ya?
124.
Okay, 124 you ambil dalam satu minggu ya?
Yes.
In 1 week.
But the total population is it 180? 180
Populasi pasien hipertensi ada 180 di puskesmas tersebut.
Oh, I see. Okay. So you want to okay, so that's okay lah.
Kenapa dari ada itu you pilih 124 saja?
With purposive sampling.
Oh, okay. 124 dia ada hypertension.
Meaning 180 people also are suffering from the hypertension, all right? The hypertension patient, all right? Okay.
Thank you, sir.
Okay, thank you for all the presenters. Now we have come to the end of our session. Before that, we would like to invite Datin.
You want to talk in the main hall or here?
Correct.
It's okay here, they all are here.
All participants, please come here. All the presenters, please come this side.
Video foto, tanggal gambar. Saya semua yang present.
Sir, madam, go in front. Go back side.
Yang tinggi ke belakang. Yang rendah ke depan. You tall at the back here. You tall at the back here. In between lah.
Go back side, go back side.
Push in front.
Go back belakang. Bisa remove, no problem. Yes.
Boleh.
This also want to bring in front, no need. Okay. You can also bring in front. Okay.
If too many, put seat lah. If too many seat, so they can sit at the back.
Later we take
Okay.
this one only for fun.
Okay, so we now open our position to the chairperson from Datin Hafizah.
Okay,
For
and go
our
back.
first chairperson, Dr.
Rosidi.
Okay.
Sorry. My apology. No need. Where's your certificate? Gold certificate.
Ready, 1, 2, 3.
Our second chairperson, Dr. Rahimala.
Ready, 1, 2, 3. All right.
Okay.
I'm not coming.
Yeah.
Take me. Okay. All.
Ready,
Ready?
1, 2, 3. Thumbs up. All right.
Thank you.
Thank you. Thank you all participants.